Hi everyone, I am Strong. Hi, hello, good afternoon. Hi. I'm strong, and I'm not really strong, you know. I got a little bit chubby, you know. The Thailand's food is really delicious, so I gained some weight. Okay. Today, I'm your presenter and host, and I am an actor as well. If you watch the TV occasionally, or TV commercial, you will see me on it. But if you are not in Taiwan, that's fine. Just click on the Netflix app and you will see me too. But after seeing that, maybe you won't have good impression on me because I'm always the bad guy in the shows. But I promise I'll be as good as I can today. Thank you. Why I am an actor? I think because decades ago, I watched the movie Back to the Future. Have you seen it? Back to the Future. That was really classic. There were so many futuristic technologies in it, like flying cars with nuclear power, or auto-dry jackets, or a power lacing shoes, or a hoverboard floating in the air, right? And so on. And they are the imaginations of the future. And the future in Chinese is 未来, right? 未 means not yet. 来 means come. And today, I want to tell everyone the future isn't not yet come. The future is coming. Before that, I want to introduce some superiors that are behind the scene and have been so supportive to us. Let me introduce Director General, Industry Department of Academia, Industry, Collaboration, and Science Park Affairs from NSTC. Welcome. Have a little talk.
Hi, Strong.
Hi.
And Director General Su from Southern Taiwan Science Park, Lead Huang from AstraZeneca, and Dr. Huang from NVIDIA. Distinguished guests, staffs, and ladies and gentlemen, good afternoon. I'm Andrea Xu from National Science and Technology Council, and my department with very long title. My job is in charge of academia, industrial collaboration, and science park affairs. So startups try to establish startup ecosystem is also one of our very important mission. So we established TTA, Taiwan Arena, in 2018 in Taipei. We try to support the academia research translating into startups and try to foster and supporting startup ecosystem in Taiwan. And we want to let TTA become a platform, help Taiwan startup link to the international community. So we established TTA South in last year. And our purpose is try to linkage all the possible resources for Taiwan startups. So why we choose this place, as you know, you may find this very wonderful surroundings. And first of all, with very convenient transportation. We close to the high-speed rail station and also close to the rail station. So you may go to all the main cities around southern Taiwan. And the second you may find here is the most promising research cluster in Taiwan right now, because you may find the autonomous car center just near this building, the Taiwan Car Lab. And as I know, we are going to establish a quantum research center near this building. And we're also going to have the hospitals, all the possible, the future like Zhang mentioned, the not yet coming technologies will happen in this place. So we set up the TTA South here. Most of all, I think most important because this place is close to the Southern Taiwan Science Park. I think also the most promising industrial cluster around Taiwan as well as around the world, because we have most advancing semiconductor manufacturing technology in Southern Taiwan. And we also have a strong medical device cluster here. And I remember Southern Taiwan Science Park launched the first biomedical industrial cluster program since 2008. And Director General Su, he also my predecessors of the Director General of Investment Department to launch such a program and successfully establish the Southern Taiwan biomedical cluster here. So you may find a lot of leading companies focused on the orthopedic and dental implants companies. So all of that, we also have AI robot incubation center in Southern Taiwan Science Park. So all of the resources establish very complete ecosystem here. So we set up TTA South since last year. So today we have very important topic, the smart health. And it's also our first time to have the situation comedy for TTA. So I'm so surprised. But also, I'm also very happy to have such kind of event because speaking of stop, all the possibilities and all the imagination could happen. So I'm very looking forward to this event and hope everyone here have an enjoyable and fruitful afternoon here. And thank you everyone for coming here. And next year, we're going to have our 1 year's anniversary. We are also have very interesting event. Hope you may join us again. And this event, that event will happen in December 16th. That will focus on the space technology. So if you like today's event, just reserve your time to join us next month. Thank you very much for coming again. Thank you.
Thank you. Thank you, Director General. And next, we are going to introduce another very important person. This is Director General Su Zhengang, Southern Taiwan Science Park Bureau, National Science and Technology Council. Please.
Thank you. Strong Square.
Yeah,
right?
Yeah.
Strong.
Yeah.
Thank you for your introduction.
Thank you.
And Director General Xu and Ted Huang and Eddie Huang, right? Both Huang. And all the distinguished guests and staffs, ladies and gentlemen, good afternoon.
Good afternoon.
My name is Su Zhengang. I'm Director General of Southern Taiwan Science Park. As you may know, the Southern Taiwan Science Park provides a one-stop service for our tenant company, not only in Tainan, Kaohsiung, but also in Jiayi and Pingtung in the forthcoming. So, Southern Taiwan Science Park in Southern Taiwan is now, as you may know, just Director General Xu mentioned the most advanced semiconductor industry here. We also have a mature optoelectronics industry cluster here, and more than 86 bio company here in our science park. Based on this solid industrial cluster, we cooperate with TTA South and surrounding research and academic institute and all the startup trying to create, not only create the industrial cluster, but also try to create a more innovative ecosystem here in Southern Taiwan. Taiwan is now facing less children and aging society. So today we have a very special show, smart medical show. The two topics, the one is smart clinical, and then the other one is long-term care. It's very important for our future. I think these two topics today will give us many inspiration and maybe have providing some new solution for our future smart medical development. So we look forward to have more cooperation and interaction with TTA and our science park tenant companies and all the startups to create a new and more innovative ecosystem here in Southern Taiwan. So welcome to Southern Taiwan, and especially experience. I wish you all have a very successful event today and have a nice day. Thank you very much.
Thank you. Thank you, Director General. Thank you. And now I need somebody's help because the future is really coming. So I need to make it like forever, like memorial. How? With your memory and photo shooting. So I got to invite two VIPs, Director General Angela Su and Director General Susan Gang, come up on stage again, and two other special guests, Ted Huang, patient Centric Innovation, lead of AstraZeneca, and Eddie Huang, solution architect, director of NVIDIA, come up on stage. Can you step on the stage? On the stage, yeah. Okay, and I got one. Everyone got this clapperboard, making the future like sci-fi movie come true. So the first photo will be open it and have a big smile. That's all. And smile. Yeah. And everyone, applause. Where is it? Hey, yeah, that's what I'm talking about. Okay, then the second one. Oh, wait. Yeah, the second one is coming. The second one, we will invite our 6 friends. Come up here. Yeah, the star-ups. And since you don't have the clapperboard, just open your arms. Yeah, like clapperboard. Okay. Those who don't have it, open your arms. Then when I count, when I count down 3, 2, 1, and everybody says action. All right? Okay. 3, 2, 1. Action! And the third, also the last one, please. We were just going to open the clapperboard again, but just put it anywhere, not in front of your body, like right or like there, like above the head. Just be creative and be cute, okay? Yes, be cute. And everyone, hey, I'm looking at you, okay? Open your arms and be cute, like smile, all right? Okay, 3, 2, 1, also action, all right? 3, 2, 1, be cute, action! Okay, a little bit slide to the right. Yeah, a little bit slide to the left. Thank you, everyone, thank you. Be careful when you get on the stage. Okay, now this is the show.
I'm fine. My bad.
Taking off is not the show, but don't worry. Okay. Oh. The system works. It's getting online. And I see all the data on the cloud. Wow, that's good. That's good. Nice. Good deal. The system is going on. Yeah. Hey,
I'm fine.
it's
My bad. I'm on it.
okay. Something wrong outside. What happened? Hello? Hi. Hey, Grace. Is everything okay outside? All right. Hey, I know. Everybody is exhausted. We don't have regular takeoffs. But, I know. The pandemic is getting, better now. But how can we do? We need to get ready for everything. But since we do have the new system, hey, Grace, I got an idea. We're going back to regular takeoff starting today. Yes, no problem. I just decided. Yeah, I hear the cheering. Yeah, let them off. Okay? The TV? Okay, I check on internet. What's it about? A news?
Now that we've all gathered for Thanksgiving, doctors are bracing for the germ spread from that gathering. The last 2 years brought waves of new COVID-19 cases around the holidays. Now it's not just COVID, but surging RSV and flu. Joining me now is MSNBC medical contributor Dr. Kavita Patel. I know everybody in my household, every single one of them, is filled with...
Grace, don't worry. I got it. Not I got it, but the new system got it. It saved us so many manpowers. Yeah. Go the regular takeoffs. All right. Goodbye. Yes, I let them take off because I got new system. I got experts and friends to help me, help my clinic to go regularly. So, who are these friends and how they help us? I want to introduce my friends. Hi. Hello. Just tell everyone how you help my clinic, okay?
Hello everyone, my name is Phoebe and I'm an AI engineer at Neurobit Technologies. So today I'm going to introduce our NeuroSwift Pro Plus system. Okay. So let me give you some general information on vertigo. So vertigo has two types of causes. So one is central and another one is peripheral. And one international survey, it mentions about the possibility of a serious neurologic disorder is unnerving to frontline physicians. And they think identifying central causes of vertigo is a top priority. So vertigo is one of the most common causes in emergency room visits. And we can see in the US, for CT scan, there are only 50% available for a CT scan of the patients. And for MRI, there's only less than 3% chance for getting the MRI. And since although CT and MRI has high accuracy, but a lot of people still cannot afford the CT and MRI scans since they are expensive. And so we need to have a tool, we need to have a rapid tool to have the screening. And that's why we have our NeuroSwift Pro Plus system. NeuroSwift Pro Plus system it provides a faster triage and analytical results for vertigo. And now let's watch a video about our system. So as we can see, our NeuroSwift Pro Plus will give us the video, and the video will record, tracking, and do the analytical results for our features. And we'll collect our features into our database. And in our database, we'll fit into our AI model, and then we'll do the classification of the vertigo. And our result classify will classify as no risk, low risk, and high risk, where low risk is refers to the peripheral type of disease, and high risk is referred to central type disease. NeuroSwift Pro Plus system, it provides us rapid screening for patients after admitted into the hospitals and before the CTs and MRI scans. And hence, its objectivity, portability, accessibility, and high precision, it can provide our medical doctors to classify the risk of a vertigo faster. And then from there, they will decide to give them CT or MRI scans. And currently, our systems are used in our global collaboration hospitals and clinics. In the future, our systems will be used in daycare center and long-term care center and physical examination center. Our system also provides some rural areas remote vertigo detection. And this is all our awards and recognition. Thank you.
Thank you, our friend, thank you. It helped my clinic a lot. Then I got a second friend to introduce everyone. So, hey.
Hi, Dr. Chen.
Hi.
Hi.
Long time no see.
Long time, really. Yeah.
Just tell everybody how your device work.
Yes. Good afternoon, ladies and gentlemen. We are Singular Wings Medical. Now we will introduce our device, BizInfo ECG sensor. This sensor adopts the technique of Class 2 ECG. Once connected with smartphone, this device will detect users' physiological signals, including heart rate, breath temperature, and ECG. With Wi-Fi technology, the user's physiological signal will be uploaded to the cloud monitoring system continuously. As you can see here, these are our colleagues in Hsinchu. So we are in Taiwan, right? So this system helps doctors monitor users' physiological signals even remotely, achieving remote health care. Once the system detects abnormal signals, it will send out alerts automatically. So the wearing way of this device is also very easy.
How to wear it?
Oh, you just stick to the skin inside your clothes.
You mean inside the clothes?
Yes, of course.
So if I want to put it on precisely, I need to take it off?
Of course, if you want.
I'm sorry, I got to let everybody knows how to use it. But I'd better not. No, it's streaming right now, you know. So I just pretend I'm naked. So I just use the belt to put it on?
Yes.
Okay. This way?
Yes, like this.
Like this? In the center of the chest?
Yes, in the center of the chest.
Okay, then how does it work?
Okay, now I'm wearing this device.
Oh, now?
Yes. As you
Now?
can see here, you can touch it.
Yeah. I
Yes.
don't believe, can you take it up to, no, just.
No, of course
no,
not.
No.
Yep. And as you can see here is my real time, it's refreshed now, I'm sorry. Now as you can see here is my real time physiological data, including heart rate, breathe temperature, and you can generate real-time ECG from this software. And from this software, if, for example, if my heartbeat is changed, as you can see, the value will also increase because I'm nervous now. If the temperature is increased because of, for example, fever, this software will also send out automatic alerts. So at this moment, based on ECG, we have also developed various kinds of applications to different types of users, such as long-term cardiovascular health reports, sleeping analysis, and high-intensity sports analysis. So this device can be applied to different situations, even extraordinary circumstances, such as battlefields. So this device can be applied to situations inside or outside hospitals. That's all. Thank you very much.
Thank you. Wow, you help a lot.
Wow.
So I need to take it off for you.
Okay. Yeah. Of course.
Can
Of course, you can keep it, but
I can keep it.
Yeah,
Okay.
but not now. Yeah, you have to introduce other products, right?
Okay. I just bought a lot. Okay. I'm sorry.
This way. Yeah.
Thank
Thank
you
you.
again. Bye.
Thank you. Bye-bye.
Bye. Okay, now we got the third friend, and who is helped me a lot too. So just tell everybody, how does the device work?
Hi.
Hi.
Hi, Zhang.
Yeah.
Yeah, this is our device.
Okay.
And I am Duncan, the founder of Genius Holding. Yeah.
Can I see it?
Yeah. This
All right.
one. Genius Holding is a company focused on ultrasound technology, and we use that in the medical application to upgrade a traditional medical device as a digitalization. And our first product, Easy Oxygen, is a personal lung function determination. We also have a partnership with AstraZeneca, Taiwan, to launch a health lung app to help asthma or COPD patients to monitoring their lung function, including reminding the medication. Since COVID-19, scientists predict more than 1 billion people will infect COVID within 1 year. And even they do a lot of home tests, face tests, vaccination, and the medication. Some people still suffering continued respiratory problems, such as short breath. And we need a new solution to help us to find a better life. So we try to use our technology to upgrade the traditional incentive spirometer. That's what we call try-breathe. A traditional incentive spirometer is generally used in surgical patients to help gain lung training. Yeah. For example, in United States, more than 900 million patients need to use incentive spirometer, and the health care will cost budget more than $1 billion United States dollars per year. So with the digitalization, we can provide a better solution. And for United States, people also can get the insurance paid for incentive spirometer, but without digitalization. Why? Because we are the only one who will launch a product this year. Okay, so Zhang, please help me to show a demo. Yeah.
Okay, how do is it?
Yeah, this white device electronics is just only need to mount the traditional incentive spirometer. Then turn on your app in smartphone and the device here, and try to inhale as fast as you can and as long as you can.
As fast as I can, as long as I can.
Yes, and you need to practice more than 100 to 200 per day. So in traditionally, you will need a paper and write down.
100 to 200 times a day.
Yes. Yeah, and the doctor will need to see how you can do.
Oh, okay.
So it costs a lot of time.
So, can I try it now?
Yeah, please.
Uh-oh.
Try better, try hard. Yeah, okay. So,
Is that okay?
yeah, you need to do better. Yeah, deep breath, okay?
I'm
you
a doctor.
Are strong, okay?
I'm a doctor.
Oh, that's good. Yeah. So your app, you can see in the screen the both status floating will directly real-time show in the app. And your achievement and your performance, you're very easy to sync in the cloud in your smartphone. For example, if you are asthma patient, take an inhaler, you can see the inhaler will do and prolong your airway smooth and breathe better. So it's the best tools in telemedicine and also help people to pass through the long COVID period. This is Try Breathe, and we will launch it sooner or later before end of this year. Thank you.
Thank you. Wow, what a smart device. Thank you. Thank you. So after seeing those devices, then I will ask another dear friend to come up on stage because he will tell us the technology, how to improve our healthcare environment. So let's have a great round of applause to Ted Huang, Patient Central Innovation Lead of AstraZeneca. Please come up on stage and have a speech for us.
Hello, thank you so much. And first of all, I would like to thank you so much for everyone being here today to see the fantastic drama today and also the great presentation from our partner. So my name is Ted Huang from AstraZeneca. As you know, quite familiar in past maybe 3 years about AZ, you may know we are one of the vaccination company, but actually we are doing not only in vaccination, we're also involved in a couple of different disease areas, and I'm going to demonstrate how a pharmaceutical company can play a role in this whole ecosystem along with the AI technology, along with the medical devices company, and along with our government to foster a better healthcare environment. So actually, for AstraZeneca, we have a couple of business units. The first one is oncology. So we cover the disease area of lung cancer, breast cancer, ovarian cancer in the first business unit. And the second business unit we call it CVRM, which means cardiovascular, renal, and metabolism related diseases. So like type 2 diabetes, like chronic kidney disease. So everyone knows that in Taiwan, we have very high rate of dialysis, like 洗肾, right? So Taiwan is quite famous in public health issue in this part as well. So for chronic kidney disease is also one of our critical pillars that we would like to focus on as well. The third business unit is respiratory and immunology, which covers asthma and also COPD. Last but not least, we have vaccination and also rare disease business unit. So as you can see, all these diseases area within the patient journey, from public awareness to diagnosis to treatment to post-treatment. Maybe after patient they go home, maybe they need to go back to the hospital or go back to the clinics regularly. There are quite different challenges within this whole patient journey gap. And that's why AstraZeneca is here to addressing all these clinical gaps along with the physicians, along with the whole ecosystem to solve this problem. So just take a few examples. For example, in asthma, or let's say COPD, in Taiwan situation is most of the COPD patients, they are diagnosed not in clinic, but in hospital. But why is that? There are a few reasons. The first one is the incentive or the motivation for the physicians in clinics setting. They are not really encouraged by the whole reimbursement system. And the second reason is that they don't have enough or good portable devices like spirometer to really help them to diagnose COPD. And that's why we have been scouting for solutions in medical device or equipment to help us to promote their great solutions in clinic settings to help the local and very rooted physicians in clinics to help them to diagnose COPD. And that's why AstraZeneca is here to address not only the medicine issue, but address the public health issue. So for AstraZeneca, in GlobalWise, we have more than 20 innovation hubs. And all these innovation hubs colleagues in charge of not only the R&D on define the drug or invent the medicines, but also scouting for external solutions in the field of AI, NLP, digital app, or even medical device or equipment. And now also Taiwan is also one of the innovation hub. We are quite aggressively working with a couple of accelerator programs in Taiwan and also international venture capitalists, and also work with E3 in Hsinchu to scout for the solution and also to mentor the startups. So in total, we have, in GlobalWise, we have more than 600 partners along the road, not only in the field of pharma-related industry, but also like anchor partner like Life Science Park in India or in Japan. And also we have mentored more than 300 startups globally. And through their solutions, we have expanded to more than 2 million patients already using these solutions. And just for FYI, we have example, we have cooperated with one of the Indian AI company called Cure AI. They provided chest X-ray AI to detect a lung nodule. As we know in Taiwan, because we have very good quality of healthcare ecosystem services. So like golden standard for the guideline is to use low dose CT to diagnose lung cancer or diagnose the lung nodule. But in rural area or in emerging market, there are a couple of huge market over there. They are lack of the machine. They are lack of CT machine, but they are relatively equipped with chest X-ray. So everyone has a chest X-ray. If you are a worker, if you are an employee, you need to do the chest X-ray. So this company basically just used their AI technology to identify the lung nodule there. And by working with global AstraZeneca team, we have been assisted Cure AI, this company, to expand their business to more than 20 countries in Latin America, in the Middle East, and also in Southeast Asia. And through our partnership just a few weeks ago, this project announced by Reuters, which is a big media company, as the Pharma Awards winners. We help them to expand this business along with the pharmaceutical companies. And also we work with PATH, which is a NGO company. They expand in Southeast Asia and also Africa. So back to Taiwan, what we have done, we have a couple of phases. In 2019 and also in 2019 and 2020, we organized 2 batches of accelerator program along with NBRP, which is National Biotechnology Research Park, and also with AWS, for example. We have received more than 60 startups proposal. We have helped more than we have helped 16 startups and mentor them through our global leadership program, provide them not only how they should shape their product value proposition, but also help them on how they can address the real clinical unmet needs and help them to connect with the right person in the whole ecosystem. And in 2020, we also collaborated with E3 in Hsinchu, opened a physical future healthcare lab and incorporate the cutting-edge technology companies and also the startup medical devices into this physical space to demonstrate how future healthcare should be looking like. And also in 2021, we have connected more than we have connected 6 innovation hubs within AstraZeneca to help all this ecosystem, to help them to go globally. Not only help them to co-develop the solution, but also help them to connect the resources from the global. And also we cooperated with Taiwania Capital, which is the partial government-led venture capitalist, and help the startup to raise funds and also help them and also mentor them along with our great partners. And also, just 2 weeks ago, we flew to Slush, which is the biggest startup event in Helsinki in Finland, along with Taiwan AI Lab, which is our partner. And AstraZeneca has a huge booth. We connect with the cross-industrial friends from technology, from media, from gaming, from fintech. The reason is we see industry shouldn't be isolated. We see there's blur and there's no clear line between industry and industry. We must to collaborate with each other. Just take one example. For example, like a target therapy, to be honest, is quite expensive for so many patients, but how we can address this financial burden to release the financial burden for these patients along with fintech company. So there are some very interesting ideas we can come up, and also we can co-brainstorming with the whole ecosystem partner, and that's why AstraZeneca is here. And just a highlight, we have been cooperating with like BE Accelerator, AWS, Biomed Accelerator from Taipei Medical University, Taiwan Capital, E3, and also we have cooperated with a couple of solution partners. They provide us with digital app, AI, in digital pathology, in diagnosis, etc. This is just a small, tiny achievement that we've been achieved in past few years, and we aim to really helping Taiwanese great technology companies to go globally, along with the whole ecosystem partner. And also, thank you so much for a great presentation from the 3 partners. We see Neurobit are really good and really leading the way in this neuroscience field in Taiwan. We haven't seen such amazing technology in Taiwan and even globally yet. So I think it's really, really great that you keep transform again and again. Like in past 2 years, we have been knowing Neurobit, and they already find a great value proposition, how to enhance the hospital's triage, how they can find a value proposition in not only hospital settings, but also in daycare settings. So I think that's really great opportunities over there. And for Singular Wings, I think they also have a great product which can provide patients with not only in-hospital diagnosis, but what happened after they go in home, back to the home. And if possible, maybe in the future or in some markets, they can, through this device, they can connect through telehealth with the general practitioners in, for example, like in not only developed country, but also in emerging market as well. And as for our great partner from Easy Action, I think they're also great and also leading the way, have so many great pipeline medical devices, not only cooperating with AstraZeneca on Healthy Lung app to really help the patients to monitor their lung function, to monitor their health situation, but also connect the great medical devices. So I think all these great solutions see the Taiwan power and energy on healthcare innovation. And also, finally, I would like to thank you for all the organizers' support for the whole event. Thank you so much.
Thank you, Mr. Huang. And I'm presenting another situation.
Hi, Mr. Chen. I'm sorry, your father has no personality. I was afraid of him falling, so I supported him to move. But he isn't used to my help, and he is also embarrassed. So he always wants to get up without telling me. This is also very troublesome for me. I'm worried every day. I'm afraid that something might go wrong someday. I think I'm not capable enough, so I better resign with you. I'm sorry for causing you trouble.
Hello? Hello? Oh my God. This is not the second, not the third, but the 8th caregiver that resigned to me because of my father. My God, my father fell down a few months ago, but he refused to be taken care of by a female caregiver. My God, but yes, maybe you can say, I'm the son, I can help him, but I cannot help him for all day long, for all week, because I got to work to make money. So I need help. I need some help that I can get. Then I don't have to take care of my father just personally. I need some experts. Is there anyone who can help me?
Yes, I can help you. I'm an expert.
Hi,
Hi.
You are the expert.
Yeah.
So just tell me, how can you help me?
Okay, if you have an injection.
Oh, injection, yeah.
Yeah, and we can use this product. Okay, this product can. Okay, let me put his arm. Okay.
Okay, I take care of again.
Okay, and I open
Just
the
like that?
device. Yes, and I open the device. When I press the button,
Oh, it turned on.
okay, it's a simple behavior and it's turned on. And
Yes.
after 5 minutes or 20 minutes, it can alert me. And why it is important? It is a reminder tourniquet. When the nurse or caregiver is so busy or the patient is unconscious, they cannot take care of his injection. If the injection is stay here a long time, it can have an abnormal event. Okay, it can have all. Okay, so we can use the alert to remind the nurse or caregiver to alert him and to handle it. Okay, and when I press the button, only one behavior, it can alert me. Okay, after 5 minutes or 20 minutes, it can alert me. So it's very easy to operate. It is do not add the operation handles. Okay, and this product in the future can combine with the IoT and combine with the NIH system to make care more comprehensively. Okay. Beep, beep. Okay, It's time's up. Yeah, so I can handle your injection.
So the nurses and the caregivers won't forget again anymore.
Yeah, it can. Once the alert, they cannot forgive for handle the injection.
Oh, that's good invention. Thank you.
Thank you.
Thank you. Thank you.
Thank you. See you soon.
Thank
Okay.
you. Home care and the clinic needs that. Now, I think I need more help. Is there anyone who can help me more? Like my joint. Wow, it looked like it helped a lot, right? How can I use it?
Hello, Mr. Zhang.
Hi.
Hi, now I can solve your problem. And first of all, I would like to invite you to sit on this chair.
Oh, that's hard work. I can do it. Oh, I just put I got an iPad too.
Yes, so hello everyone, my name is Abby from Free Bionic. Today I'm going to introduce our new product, Nimble. As you can see, Nimble is an innovative training device that can improve your joint mobility and muscle strength in a safe and efficient way. So after the sitting is finished and all the setting is ready, the first thing I would like to ask Mr. Zhang to do the first step is the evaluation.
Evaluation, all right.
Yes, so the evaluation will check the range of motion of your joint.
Okay, how do I do it?
Okay, so we count on 3,
Yeah.
2, 1, and ready. Now you can try to move your leg a little bit.
It detects my movement. Oh, just in real time.
Yes, it's real time. And now I would like to ask Mr. Zhang to imagine if it's your father, how far his leg can reach.
If I was my father, will be like this.
Yes, please try your best to move your leg up to the top.
Maybe my father is like.
Okay. And move down to the maximum.
Down to the maximum.
Okay,
Like this.
very good. Now we already finished the first step is evaluation.
Wow, that easy.
And let's check our result. Here is Mr. Zhang's result.
My father's. My father's.
My father, your father.
And how can I do with this result?
Yes, actually, the result shows how much power you use in different angle. In your movement.
Okay.
Yes, as we can see, Mr. Zhang's father's power is a little bit weak between the angle 0 to 20.
Okay.
Okay.
That's my father. Okay.
Okay.
I am strong. Okay.
And how can we solve it? And actually, our Nimble can provide a customized training program, and we can just focus on our weakness part to do the precise training. And in our training program, we can set up the data such as the angle, power, and speed. And we just pretend now we very, very hardworking to do the exercise.
Okay.
Okay.
Like this.
Yes. Very good.
So it will automatically move by itself to help me.
Yes, exactly. And after several times of the training, now we can see the post-test result right away. Ta-da. Yes. Now you have improved.
Yes, I got improved. Oh, my father. Yeah, okay. Then I can use it on my knees. Can I use on other places?
Yes, exactly. Actually, our Nimble can also apply on our shoulder, elbow, waist, hip joint, and also the ankle with different accessories, as you can see. And our target audience will focus on the sarcopenia, osteoarthritis, orthopedic surgery, and neurological injury. And it will cover more than 20% of the population. So it's a huge market to explore. And compared to the traditional rehabilitation, we provide the data-oriented remedy. And there is 3 highlights I want to emphasize. The first one is that we provide the pre-test record for you so that you can easily to find out where is your weakness. And the second one is using our Nimble to do the training program. It will ensure the quality of the motion and also guide you to do the correct movement. And the third one is that after the training, you can check your post-test result anytime if you want. Yes, that's all for me. Thank you.
Thank you.
How does it feel?
Thank you. Untie me. Thank you. My left leg is so strong. Sorry. Wow, so powerful. Wow. Hey, my right leg needs it too. Hey. Wow, that's useful. You can use almost any joint in your body. That's good. But maybe there is more help from another expert? Hi. Wow. I am the comedian. You're not, okay?
This is why I need to introduce our product.
Okay.
Nice to meet you.
Okay. Just show us.
Okay. There are more and more elderly people suffering from some frailty problems, like your father and maybe me.
Yes.
Especially after the pandemic. So we propose a new rehabilitation service, enable patients to recuperate from home. our rehabilitation service is called Intelligent Health Promotion Service System. We hope everyone can live independently and enjoy life. Our service provides 3 major features and subsystems: gamification, customization, and intellectualization. And I think this is a good solution for the situation like you and your father. Because okay. Why? Because your father can do rehabilitation at home, and you can understand the situation immediately through the app. Oh. Also, the information will send back to the doctor so that the doctor can make a diagnosis precisely. Yeah, so this device can play games like Nintendo Switch, but it can collect muscle data more accurately because we use EMG and G sensor.
Nintendo Switch?
Yes, yes.
The Nintendo Switch, just like that? My father loves video games. How to play it?
Yes, first I'll show you. You need to put on the device like this on my leg.
Okay.
Yes, and there will be some instructions for you to telling you how to do it.
Okay.
And then you can start a game.
It looks like a game.
Yes, yes. There are different kinds of games corresponding to training different muscle parts. And the whole game were designed in nostalgic style to increase elders' motivation. And there is also a virtual trainer who will teach you how to move and react. Okay. And we have different monsters and different levels to adapt to every user's needs. So next, I will show a little bit in-game screens about how the game actually works.
Oh, it works like that. Okay. Wow.
Yes, so finally, when the game is over, you can make sure your dad is healthy and the doctor can understand the patient's situation. And the most important is that your father can gain accomplishment and the freedom of movement.
Wow.
And in the future, we hope that our systems are not only for the elder, but our database will bring more applications and free everybody's life. Thank you.
Thank you. I think my nephew will like this, and I hope my father won't kick after he healed. Okay, so thank you so much for your help. Thank you. Wow. So all these devices and softwares needs what? I think all they need chips. And who does chips? Yeah. Now I want to introduce Eddie Huang, the Solution Architect Director of NVIDIA, to have a speech for us. Welcome him.
Hi. Thank you, Strong. That's when I wake up this morning, I know I have the schedule here. I can imagine how interesting, how humor, and for this event. Thank you so much for bringing the great time for all the attendees here. Hi everyone. Good afternoon. First of all, I want to thank you, Andrea, to help me to join this event. I'm very grateful. And secondly, hi, I'm Eddie Huang. I'm working in NVIDIA. As a famous like you Strong introduced. Actually, NVIDIA got popular, got very well known on the GPU. But actually, we are not just provide our product for the gaming stuff. Actually, we occupy more than 90% of the market in the gaming. But not only that, actually, we are the platform company. We build up, we design the chip, and actually we build up the hardware, especially for high-speed accelerated computing cluster. But also, more importantly, that we provide the software tool for people, for developers who working on their AI development in the cloud, in the edge, in the micro edge, and also. So let me introduce some of our product to you guys, and then you guys to know to know how the high overview of our product, how to help you guys. And most importantly, I want to say here, like it's for the this event is for the startup, right? So actually, like in NVIDIA, you know, like in this real-time age, that of the employee is, you know, it's freezing their job opening. But in Taiwan, actually, we need a lot of the expertise who can work on for the startup. So we have a real own NVIDIA startup incubator called the Inception Program. So maybe we can work together. I'm glad this is a TTA play. We are not competitor though. You know, we bring the resource to startup as well. So let's let me show you guys like what we have and what we can work with the startup and all the developers together. Trinity of AI, like the great three startups, and including the previous three, like AI would be the critical or the most important component in the future. If you want to update your devices, your service, AI would be the key one. You know, AI is like it's hard popular the field right now. But when you talk about AI, we have to think of the trinity of AI. The first one would be algorithm. The second one is data. The third one would be computing. Anytime, any place, any location. If we're talking about AI, if we want to do the AI, you're gonna think these three items together simultaneously, without consider another two. So you either, you know, what AI you gonna do will be the kind of like, you know, not embarrassing, not purple. Why is that though? Let's go for the first one. AI is what is AI like? To me, this is like when you like to listen to music you like, you can play the in like 10 years ago, we have the CD. Now we have MP3 file. We put that into any machine, and then you can, you know, right now most of possibility that you use the iPhone, right? Some of them might still use the music recorder, but when you want to listen to music, put it on, and just one button, you can listen to music. And that's the first time that in the human future, you can put your ability, like human-like ability, into the machine, and then the machine just act like you. So I would think this AI will come up like you can think, imagine it, like how machine can be more powerful, can be the human assistance to you guys, which will bring the, you know, new whole environment, either in your workplace, in your private home, in any place. Most important in your workflow. So you're gonna think about it. This like is your workflow gonna replaced by the machine, because the machine gonna learn your ability by using AI, and it's kind of like software. More likely, it's like think of an MP3 file. It's more like that. So the market's there, the future is there. And another one is I want to share here is the metaverse. Like to make others become more reality, like it's going to become the dream will become true. I'm talking about this seriously, because why? Because the AI is growing, its improvement rapidly, day after day. Really quick, we can generate the environment, we can generate the sound, we can generate the image, we can generate the video. Why is it so important for this metaverse? First of all, it's for human being, right? But for human being, that would be kind of like it's gaming, like you can play the video game. Oh, of course, that's one of the one like for enjoyment. But secondly, the most important about this metaverse or universe, it's for machine. Why? Because machine needs AI, machine needs ability. All the medical devices like guys you show here, or the service you show like here, like you need to optimize. You need to let your devices or let your service to get much close to the end customer that you want to serve. So this metaverse, this virtual world can be built by the AI. So that's why. And your machine, your service can train or can be optimized in the metaverse and the virtual world. That's easier for you guys, and totally will be, if we use like NVIDIA platform, that will be very easy for you guys. Our products there, we let's go next. That's the AI improvement library. Like it belongs to the algorithm. I won't spend too much time for the for you guys, because that's for the data science. That's for data science job. I'm showing here is like I'm talking to you like all the algorithm, like the most smart people around the world. They spend a lot of time, smart resources in here. So there's the key part though. This is the time zone, and then I want to share you here is like I'm talking to you like 10 years ago, like 2012. Like people with artificial intelligence can resolve all the computer vision challenges. They can do the recognize. They can do the you can see they can do the segmentation. They can do the object detection. They can do the facial recognitions. Most of 99% of the job by human being that doing to do the challenge, artificial intelligence can be resolved right away. And right now, but this artificial intelligence can be more aggressively to work on the understanding right now. The understanding is not exactly the people do here, but they can do the sequence data. They can understand the language. Then they can do the translation. They can do the QA. They can do the writing and so on. So in right now, like human being can do that 70% of the daily job, like artificial intelligence can overcome it, and it can do it much better than the original one. For the sequence job, it's not only by the sequence, the natural language process about talking about here. It's more like the chemical compound or the protein structure. Like if you like focus the some the high-end academic research, they might create the neural network can predict the protein structure by Asimo Emmet. So, which means that it can reserve so many like tiny chemical and basically interaction by the compound, chemical compound, and the basically physical conditions. So that's what what AI did in the algorithm component. But there's the big the key part is here though. The middle one shows like the horizontal is the ear, and the vertical part, and the vertical part is how much computer resource you need. Because you want the AI become smarter, AI become the neural network become the deeper. Neural network become the more complex. So what it needs, it will become the you need the become the all neural network connect together will be very complicated. So you need more computer resource to put it to run it at in the real time. So that's the trend I want to share to you. Like first part, the algorithm become more bigger. So this slide show you how to deal with the computing part on the machine. In traditional computer, like we all about, they have the CPU, and the majority of the CPU has CPU work on the to run the OS, run the app. But actually, the traditional CPU is not as efficient as now, because that designed for the most calculated, the logic computing. But in this right now, for all the AI algorithm, for AI running the inference for training stuff, most of the computing is for the logic computing rather than just the logic that distinguish it all. So the traditional computing is not as will be work good efficiently in the future to running on AI. So that's why NVIDIA provided not only hardware but also the software. The software is so important upon the hardware. Like without two hardware and software working together, it's not easy to deal with the future computing in real time. So I'm not go through the whole stuff, but you can see from bottom up we have GPU, but also we have the CPU. And Not only that, but we also have the DPU to deal with the communication between the communication between the two servers or two computers want to work together. And upon that, we have the different software library. Software, you can consider as a dictionary for the people, for the data scientist developer, for IT developer. They don't have to go down too deep to run the basically function to use the multi-GPU to use the double computer to work together. You can just only the few command or few coding that we provide to you guys though. And upon that, we have the third layer. You can go to the different application. But different application, different platform name, I'm not go through that. Just let you guys know though, to dealing with the high computing, working on the to run the AI is not easy. But we are working as much as we can to embrace all the ecosystem to different kind of the workflow. We optimize it by our software and the hardware. So our software hardware can like save your money. Like from our CEO Jensen's say, the more you buy, the more you save. That is quite odd, right? But yes, trust me, the more you buy, the more you save, because you save your electricity is most important. You save your time when you work on the AI. That's our platform for the PD. I'm not go through that whole the ecosystem. We try to work with that. But those are the those are the giant company though. But as I say, Inception is a key one that we spend a lot of time. So that's why I'm here. And that's the one platform, especially for the medical imaging. But for the today's stuff here, maybe you guys that focus on the for the medical image. But please, like if you're dealing with any imaging stuff, you don't trust me. Like you want to get through it, because like we optimize, we speed up, accelerate all the algorithm for the state of the algorithm for pre-process and for post-process. Probably can help you guys to save more your time. But if you get on the to deal with the your medical device for your signal into this Monite platform though. Like let me show you some the third part will be remember the data I'm talking to you guys in this triangle. That's the key part though. The data is like the advanced data set is not talking about the original data set that we're talking about, because remember I mentioned about the universe. Like this, the synthetic data is like it's artificial, the human made it combined to generate it. We use the AI to generate data. This data is more accessible for the device, more accessible for the physician, more accessible for the people you want to create the AI. So that's the basic information. Now you can see right now we only talking about the real data in the future in the 2030. That's the capacity that for the real data. But actually for the machine to create the AI, we need more data. And this data could be not found for maybe the time is not accumulated enough for you to get so much data that we need to create a kind of AI. So that's why the synthetic data is so important. That's a pretty popular and hard research stuff in this right now. So in 2000, we can see that data is generated by AI. You can see like that's a startup. They become a unicorn because of doing that diffusion, that AI, and so on. Though you can go through, you can double check with the news though. Finally, synthetic data is important. Like what I say, the purpose is to create AI, but not only that, but they guarantee the privacy. There's no privacy issue. They made AI more robust, and this data is all feasible and shareable to your guys who are to share to the whole ecosystem together. So this is the one research I think it's cool to me though, because I spent 20 years in working on the medical imaging. This is the brain MR imaging created by AI. If you look up, you just input your genetic data, your death rates, your age, and some physical data. Then the AI will generate the whole your life, the CT image should be look like in normal. So anytime when you go to the go to do the CT scan and compare the data set, you should be, and you can see that if there is a difference between each other, there might be the abnormal stuff or diseases that happen in your current stage. So that'll be a cool one, and it's more like the synthetic data research that I want to share to you guys, and it's pretty hard in published in the Nature, last year though. That's another one, because of time limit, I'm not gonna share that, but you can know how to teach a machine to work as the surgeon, do as good as the surgeon. You can work on, you can put your machine or your medical device into this universe simulation environment and make it will become smarter and good enough for the law. Here's my my email. I'm more than welcome to help you guys if there's any question regarding the NVIDIA platform was software and hardware. I'm more than happy to work with you guys. So thank you guys again, and thank you, Angela, for giving me the for showing me this time though. Thank you.
Thank you, Mr. Huang from NVIDIA. Thank you. And I'm sad it's the end of the show, but I'm happy it's the start of the future. I want to thank all 6 startups. They deserve a big hand, right? They did a good job today. They act with me. I'm a famous actor, and they act with me. So, and I'm proud that we have Director General Xu and Director General Su and 2 special guests here. We give them a big round of applause, okay? Thank you for your attendance. And thank everybody here. We hope you enjoy this event, and we hope see you soon. And if you are interested, all these startups are ready to sell their products. So if you're interested, just come up later and just try to use it. You will love it, or convince your doctor to buy it, okay? So thank you, everyone. We'll see you soon. Goodbye.